Signing an organ donor card, it recognizes that you understand the values behind organ donation, and you're expected to make a decision at the time that you're signing as an organ donor. The issue is that not everyone is aware about the need of organ donation, and not everyone has a clear understanding on all the process that is behind organ donation and how the different regulations are there to ensure that organ donation happens in a responsible way. So there's a lot of fears and beliefs about organ donation that needs to be clarified, and that's where social media seems to be a powerful tool. The importance is about clarifying those myths and fears that the population has, and try to change their attitudes about organ donation in general, and then that promotes a behavior where people go and effectively says, I want to become an organ donor. Try to understand our communities, try to learn what and how are they thinking, and how we can best respond to their needs from an educational standpoint, and also how can we best respond in the way that we reach them. What is the more effective way to reach them? Is it through ourselves as healthcare providers, or it is through our intermediate or influencers that are calling social media, that we can work with in order to try to reach that specific audience. It was a very well-known campaign, specifically by Facebook, when they added adding your status as an organ donor in their timeline. But that had certain limitations in the fact that everyone wanted to be an organ donor. A lot of people was already signed as an organ donor, but also the effect that this had vanished over time. So there was still a difficulty to try to maintain this effect over time. One of the important things is how you can build an audience and engage your community, and that's the key of having that's key for social media to be more effective than other media like TV or radio or other kind of ads. Is just the social engagement it's basically social engagement. I think probably one is just to put ourselves every time in the shoes of the other person and think that that person at some point can be ourselves, or someone that we love can be the one that needs an organ transplant. So if we make decisions about organ donation the way that we do, as the way that we would expect that to be, if this would be something that happened to ourselves, then we should be able to recognize the importance and specifically seek the information that is necessary to make that decision. Because this is building a culture of organ donation, and the thing is that we have leaders that emerge naturally in the society, and we follow those leaders because of their principles. Unfortunately, take those events for the people to raise awareness, but that demonstrates that when people is engaged with meaningful a meaningful cause by a leader that they really trust, that this can be an effective way of changing a behavior or changing an attitude and promoting a behavior. This is what we want to do with social networks. So is engaging, identifying what are the needs, identifying those role models, and trying to model these model interventions that are able to work with these influencers in order to transmit the importance of organization to the people that really trust them, and then those people to serve further as carriers of the message of organ donation. They're going to make their friends more likely to donate if they become an organ donor. So if you are an organ donor, then your friends and the friends of your friends are more likely they're going to become organ donors. The role of the doctor will be whenever new patients are going to come and they will raise the question about organ donation, to be informed, to be able to address those questions. Is the information now reach the people rather than the people going to look after the information? So this is our opportunity, is to develop the systems that are going to reach the people effectively and inform the people so they can make the appropriate questions.